Hello everybody, talk about kidney failure. So let's get started. First, what is colorectal cancer? Colorectal cancer is a cancer that starts in the rectum or colon. Both of these organs are in the lower portion of your digestive system. The colon is also known as the large intestine. The rectum is at the end of the colon. The American Cancer Society estimates 1 in 22 men and 1 in 24 women will develop colorectal cancer during their lifetime. What are the 4 stages of colon cancer? Your doctor may use staging as a guideline to figure out how far along the cancer is. It's important for your doctor to know the stage of the cancer so they can come up with the best treatment plan for you and give you an estimate of your long-term outlook. Stage 1, the cancer has penetrated the lining, or mucosa, of the colon or rectum but hasn't spread to the organ walls. Stage 2, the cancer has spread to the walls of the colon or rectum but hasn't affected the lymph nodes or nearby tissues yet. Stage 3, the cancer has moved to the lymph nodes but not to other parts of the body yet. Usually, 1 to 3 lymph nodes are involved at this stage. Stage 4, the cancer has spread to other distant organs, such as the liver or lungs. What are the symptoms of colorectal cancer? Colorectal cancer may not present any symptoms, especially in the early stages. If you do experience symptoms, they may include constipation, diarrhea, changes in stool color, changes in stool shape, such as narrowed stool, blood in the stool, bleeding from the rectum, unexplained weakness, passing excessive gas, fatigue, unintended weight loss, abdominal cramps, abdominal pain. If you notice any of these symptoms, make an appointment with your doctor to discuss getting a colon cancer screening. What causes colorectal cancer? Researchers are still studying the causes of colorectal cancer. While there's a growing list of risk factors, they act alone or in combination to increase one's risk for developing colorectal cancer. 1. Precancerous growths. Abnormal cells accumulate in the lining of the colon, forming polyps. These are small, benign growths. Removing these growths through surgery is a common preventive method. Untreated polyps can become cancerous. 2. Gene mutations. Sometimes, colorectal cancer occurs in family members. This is due to a gene mutation that passes from parent to child. These mutations don't guarantee you will develop colorectal cancer, but they do increase your chances. Who's at risk for colorectal cancer? There are some factors that may increase your risk of developing colorectal cancer. 1. Unavoidable factors. Some factors that increase your risk of developing colorectal cancer are unavoidable and can't be changed. Age is one of them. Your chances of developing this cancer increase after you reach the age of 50. 2 avoidable factors. Other risk factors are avoidable. This means you can change them to decrease your risk of developing colorectal cancer. Avoidable risk factors include being overweight or obese, smoking, a heavy use of alcohol, having type 2 diabetes, having a sedentary lifestyle, consuming a diet high in processed foods or red meats. 3. Some other unavoidable risk factors are a prior history of colon polyps, a prior history of bowel diseases, a family history of colorectal cancer, having a genetic syndrome, being of Eastern European Jewish or African descent. How is colorectal cancer diagnosed? An early diagnosis of colorectal cancer gives you the best chance of curing it. Your doctor will start by getting information about your medical and family history. 1. Blood testing. Your doctor may run some blood tests to get a better idea of what's causing your symptoms. Though there's no blood test that specifically checks for colorectal cancer, liver function tests and complete blood count tests can rule out other diseases and disorders. 2. Colonoscopy. A colonoscopy involves the use of a long tube with a small, attached camera. This procedure allows your doctor to see inside your colon and rectum to check for anything unusual. During a colonoscopy, your doctor can also remove tissue from abnormal areas. These tissue samples can then be sent to a laboratory for analysis. 3. X-ray. Your doctor may order an X-ray using a radioactive contrast solution that contains the metallic element barium. Your doctor will insert this liquid into the bowels through the use of an enema. Once in place, the barium solution coats the lining of the colon. This helps improve the quality of the X-ray images. 4. CT scan. CT scans provide your doctor with a detailed image of your colon. When used in diagnosing colorectal cancer, another name for a CT scan is a virtual colonoscopy. What are the treatment options for colorectal cancer? Treatment of colorectal cancer depends on a variety of factors. The state of your overall health and the stage of your colorectal cancer will help your doctor create a treatment plan. 1. Surgery. In the earliest stages of colorectal cancer, it might be possible for your surgeon to remove cancerous polyps through surgery. If the polyp hasn't attached to the wall of the bowels, you'll likely have an excellent outlook. If your cancer has spread into your bowel walls, your surgeon may need to remove a portion of the colon or rectum, along with any neighboring lymph nodes. If at all possible, your surgeon will reattach the remaining healthy portion of the colon to the rectum. If this isn't possible, they may perform a colostomy. This involves creating an opening in the abdominal wall for the removal of waste. A colostomy may be temporary or permanent. 2. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells. In the case of colorectal cancer, chemotherapy is a common treatment after surgery to destroy any remaining cancerous cells. Chemotherapy also controls the growth of your tumor. 3. Radiation. Radiation uses a powerful beam of energy, similar to that used in X-rays, to target and destroy cancerous cells before and after surgery. Radiation therapy commonly occurs alongside chemotherapy. 4. Medication. In September 2012, the U.S. Food and Drug Administration approved the drug regorafenib, Stivarga, to treat metastatic, or late-stage, colorectal cancer that doesn't respond to other types of treatment and has spread to other parts of the body. This drug works by blocking enzymes that promote the growth of cancer cells. The bottom line. When it's caught early, colorectal cancer is treatable and often curable. With early detection, most people live at least another 5 years after diagnosis. If the cancer doesn't return in that time, you're considered cured, especially if you're in the first 3 stages of the disease. That's all for this video. If you find it useful and you liked it, please click on the like button below the video, and subscribe in your channel, Be Your Doctor, and please don't forget to activate the bell to get all our new videos in your notifications. Have a nice day.